about Frank's experience with diabetic foot complication. Frank has diabetes-related neuropathy for multiple years, and 20 years ago, he developed a condition known as Charcot, which is a collapse of the foot with multiple fractures in it. He went undiagnosed in our healthcare system for a year and a half. Nobody knew what it was. Nobody gave him a diagnosis. And in the meantime, his whole foot was collapsing. If you and I had a fracture, we would be casted immediately. One bone, his whole foot collapsed, and no one knew. There was strong lack of awareness amongst healthcare clinicians. And he went on to develop a strong deformity and eventually a breakdown in his foot, a sore in his foot. He required 2 surgeries, and he developed an ulcer. He went on home care for a year and a half. And then finally, somebody found their pathway to a wound clinic. And within 1 month, timely access to care, within 1 month, his wound was healed. So if Frank had what we all want, which is access to the right care at the right time, the system could have saved on multiple surgeries and 1.5 years of home care. And he would have been healthier and more productive sooner. So Frank, I want to ask you this, if you don't mind sharing, and were your clinician knowledgeable at the time that you went to seek help?
No. And believe me, that's a simple answer. What happened was my foot collapsed. Nobody knew what had happened to it. I got a friend of ours was a nurse, and she said, this doesn't look right to me, and got us in touch with an infectious disease specialist who walked into the room.
No, first of all, tell them that they gave
Let me introduce my wife, because without her today I wouldn't be here, and she knows more of the story than I do. She's the advocate.
I'm the private care health practitioner without a degree. So when this happened to Frank, of course, nobody knew what to do, so they thought he had an infection. He ended up in hospital, and they gave him mega doses of antibiotics, and nothing went away. So one of our friends is a nurse, and she said, you know, this doesn't sound right. You have to go see this infection specialist, the doctor, and she will call you, and you have to go see her. And we went to see her. It was on a Friday night, and she said, my name's not on the door. And I said, oh my God, Frank, where are we going? And she saw him, and she took all his medication and just threw it in the garbage. And I go, oh my God, what are we doing here? And she said, you don't need these antibiotics. You need a proper person to look at your feet, an orthopedic man or woman, to look and see what's going on there. And that's where our journey started. Now, I have to be an advocate. I know he's going to speak, but with every patient who has an amputation, you know, there's the family that's involved. You know, it's very hard on the patient as well as the family. It's hard on everyone because it's a huge adjustment. There's a woman sitting here who's had multiple issues. I don't really know her, but I'm sure it's been very hard on herself and the family. If it wasn't for my constant looking at his feet, and you know, we've had multiple experiences where, you know, we were going to hospitals because he had breakdowns, and then one day I just said, Frank, we've got to go speak to someone else. If this was their foot, where would they go? And they introduced us to Miriam and her team. And I have to tell you, it was if I had to pay for it, it didn't matter how much it cost, it was worth every penny. They directed us accordingly, and they have taken care of Frank's feet and foot and legs, because it's not just the feet. It goes to the leg, it goes to wasting on the legs and everything. Game over.
Thank you, Susan. Well, thank you for being an amazing advocate. So really, foot screens, preventative foot care can reduce complications in persons with diabetes. We need more awareness, and we need clearer pathways within our system that can facilitate care for patients like Frank. So Frank, I think Susan covered this area. What did it take for you to get the care that you needed? And certainly it is a strong advocating family and continuing to search for those pathways. But unfortunately, it wasn't very clear. And Susan commented on it that even now, 20 years later, those pathways are not very clear within our system. You didn't know where to go. You still don't have very clear pathways, and we need that for our patients. Northern communities don't have these clinics. I mean, we're lucky we're here in downtown Toronto, many clinics, but northern communities certainly don't have enough of these clinics. Currently, it is very difficult, as you pointed, for patients at risk to get preventative care of treatment, and we need better informed clinicians within our system that can recognize these conditions and manage them and prevent more suffering. So I want to stop here at one point because this is a really important point, and the system doesn't cover this point. How important for you to wear your custom-made shoes?
I can't walk without shoes or a special pair of slippers. And in each one, I have to have a special orthotic. So I can't just, even when I step out of a shower, I have to have my shoes there. Because the bottom of my foot is curved. My ulcer is in the center. And to protect the skin graft, they have to cut me from toe to heel, turn it 90 degrees. So I've got a lump in the bottom of the center of my right foot.
And how much do you have to pay for those shoes out of your pocket?
I'm lucky, well, to a degree. My wife we both still work. She has a drug plan. But even with the drug plan, it still costs us a lot of money. The shoes cost, with the orthotics, molded, casted, and made, $1,800. But the drug plan will only pay $500.
So if you didn't wear your shoes, Frank, would that mean that you would develop an ulcer?
Definitely.
So then the system would cover you for managing your ulcer, but it won't cover you for preventing your ulcer.
This happened 20 years ago. And touch wood today, I'm lucky, because they didn't expect it to hold that long. And thank God it's for the footwear that I have. I probably would have had an amputation by now.
Thank you. So it is obviously preventative devices will make a huge difference and also save the system money for amputations and ulceration. Prevention certainly costs less than amputation, and we're really glad that you continue to work and are a productive and healthy citizen of Ontario, Frank.